Hi, my name's Jim Pate. I am the Senior Physiologist at the Marylebone Health Group and Laboratory Manager for the Exercise Testing Lab. I am here to talk today, to everyone today about clinical exercise sessions. Typically what I'm talking about is when somebody comes into our clinic, okay, and it could be maybe just 30 minutes or maybe up to an hour or maybe even longer perhaps. But basically, they need a safe place to exercise. So, because they've been told by their doctor or some another healthcare professional that that they need to do exercise, or exercise will be beneficial to their health or help them manage an illness or something like that. So a lot of times when people are coming in here, they need a safe place to exercise, and we're a CQC registered clinic. And we have all the necessary facilities to be able to offer this. In high risk environment stuff, like we don't handle that. But like when people need exercise that's prescribed by a doctor and pre-screened against kind of like any of the contraindications that might make it dangerous, we provide them with the space. Not only is it safe, we like to pair it with kind of objective assessments of their fitness and their body as well too, to make sure that what we're going to be doing with them is both effective as well as appropriate to them. Now this is stuff like getting them to do actual exercise tests like cardio-pulmonary exercise testing, which I talked about in another video. This also could be kind of like physical testing that like a physiotherapist or somebody might do to look at a person musculoskeletally. Or indeed, we can do other kind of testing to look at like how strong somebody is, or the muscular condition as well too. So, also what this allows us to do is have like a very data-driven approach, essentially, to prescribing exercise or providing exercise guidance to our patients, whatever their health goals may be. Like I said, if it's like a preventative sort of thing. Then most of the time, this is the vast majority of people, they come in here, they're healthy folks, they want to make sure they remain that way. And so when we're doing exercise with them, it's usually when they're starting a new exercise program, for example, and they haven't really been doing one, and they want to make sure that whatever it is that they're doing is going to be beneficial and work for them. The other thing that a lot of times we do with folks, like if they're going to change their exercise program or something like that, and they just need to be trying to manage any risk that might be associated with like a new kind of challenge, whether it's physical, of whatever nature that might be. They're directly referred to us by either external clinicians or internal clinicians. And this is, like I said, a very kind of prescribed process. The programs can last however long they're supposed to, although usually there's kind of like a stated goal and clearly a clear stated length of time that's going to be kind of like done before there's a reassessment with the patient and the patient's status. Clinical exercise testing sessions, in addition to like trying to manage like an illness or necessarily try and prevent illness, we can also use them to rehabilitate people. So for whatever reason someone might have been deconditioned, usually it is as a result of illness, or perhaps the kind of treatment that they've had in order to manage disease. Clinical exercise sessions allow them to, again, have this approach where we're going to just get them back to normal activity in a very safe and appropriate kind of manner. Clinical exercise sessions usually involve both a strength component, which is like a muscular component to them, as well as an aerobic component, which is, or sometimes known as like a cardiovascular component. People will already be familiar with this sort of thing. Anyways, if they have had any kind of session with like a physiotherapist, because even though the physio will be doing some exercises that are really specific perhaps to an injury or as part of recovery from an operation, the physio will also prescribe or encourage their patient to undertake cardiovascular exercise as well too. This is just one example, because if anybody has experienced cardiovascular rehab, perhaps after like an event where they've had a heart attack, unfortunately, or a stroke or something like that, then they're as part of their rehabilitation, they're obviously encouraged to do a lot of aerobic activity, but also there is almost always prescribed a component where they're encouraged to do the right kind of strength work to also help complement and boost their muscles as well too. So we have the capability to do all of that here at our clinic. And like I said, as a result of this, we see people referred in a lot of times from all sorts of disciplines. A lot of times, like I mentioned, it's physiotherapy. It could be sports medicine, though, cardiology, surgery, neurology, general practice as well too. We get a lot of patients again who are probably more preventative and not ill, but also might have some problems with their exercise and need some guidance and some reassurance with someone who's going to work with them, like kind of one-to-one, and make sure that what they're doing is right and backed by good clinical practice and sound kind of methodology.